easily digestible. So now let's take this slide and we try to sort it and then see if we'll manage to do anything. If it's going to be easier for us to spot the numbers. So again, I will give you some numbers. The same slide, 20 seconds. See if you can find them. I will change the slide after 20 seconds. So I hope you're ready. Time is up. Was it any better? Were you able to spot the numbers a bit easier, considering that we had decluttered the slide? If you remember the previous slide, there were many more numbers that were unnecessary. Since we are looking for number 1 to 49, this slide decluttered the other numbers. So we can further improve this number arrangement. Another 20 seconds. It's going to be step 2 now, where we are going to set. So once again, setting in progress. You have the slide here. So time is up. So did you manage to see that once the numbers are organized into the quadrants, hopefully it was slightly easier? Maybe you can drop us a message in the chat box. So as you can see,
Dr. Karima, someone wrote in the chat, much better, a bit better.
okay, so there are responses. I'm glad people are following. So now this is after setting, everything has been divided into quadrants. And if you will notice, there's a pattern. Number 1 is in this quadrant at the bottom left. Number 2 is in this middle left quadrant. Number 3, top left. Number 4 here at the bottom, 5 coming upwards, 6, 7, 8, 9, going back 10, 11, 12. So if you see, there's a pattern. Now, once you have the pattern in mind, if somebody asks you to find a number, as you go with the pattern, you'll be able to find it. So that is the essence of sorting, setting, shining, and standardizing. The next slide is just going to give you an example of what it should be when you have standardized. So this is now when you standardize it, which means you give every number its designated place. Finding any number is going to take even less than 5 seconds, isn't it? Because you already know it's 1 to 49. They're all organized, they're all arranged. Each of them has their own space. Compared to the previous slide where all the numbers were all over the place, here each one has its own box. So when you think of 5S and 6S, what you are doing essentially is just bringing some sense of organization to your workspace. If it's a mess, 5S is going to bring everything together, bring everything to normalcy. So in healthcare, for us, when we were looking at those pictures, those slides, 20 seconds, we couldn't even find the numbers. But at health facilities, sometimes all we have between a patient's life and death is a few seconds. So just imagine having a mess in the emergency room where nothing is labeled, or the defibrillator is not working, it's not in its place, the syringe container isn't refilled, the emergency tray has expired drugs, or the bed linen on the emergency bed has not been changed. So the only thing you'll do is move around like a confused molecule, while your patient's prognosis will move from bad to fatal. So what we're trying to say is these small things that we might take for granted, simply replenishing something or putting a simple label on a part of a medication on a container, settings, our hospitals or our health facilities. There's so much going on. There are several movements. We have the flow of patients. We have the flow of healthcare workers. There's the flow of vehicles like ambulances, the flow of information, and even the flow of materials and equipment, isn't it? So keeping such an intricate health system from collapsing, it's going to take a lot of organization. So at the backbone of all this, as one of the components, is quality improvement and success. So the success of
Amanda, huyo nini Amanda, si ndio? Daudi imepotea.
sorry, if someone hello? I request someone to please mute.
Continue, I've muted them.
Okay, so the sixth S, which is safety, encompasses infection prevention and control within our health facilities. Finally, when you look at even within our health facilities, most of the time it has been a kind of a mindset that 5S is for the pharmacy or 5S is for the lab. But that's not really the case. Within a facility, every space and place requires Kaizen. From the reception, where you're going to meet the client, where they're going to sit within the waiting bays, how you're going to document them, how you're going to maintain their queues. Within the wards, everything needs to be spick and span and organized. Crash cards need to be handy. The same applies to theaters. Your emergency drugs have to be within a hand's reach. Of high importance is also true the pharmacy, and 6S at the pharmacy is very important. The reason for this is because of the sheer bulky nature of commodities. And we all know sometimes brands and packagings are so similar. So if you don't find a way or a system of sorting them and setting them in such a way that they're easily distinguishable, when maybe you have a high workflow or high workload, you can end up making small mistakes which can take a patient's life. A drug administered the wrong way can cost a life. There are thousands of medicines. So conducting 6S at the pharmacy is quite key. So we shall now look in detail at 6S and the tools that we utilize within 6S. So first of all, what is Kaizen 6S? Number one is sort. A brief summary is what is needed, what can be discarded, and what is needed but not always. So this is just basically what you are going to do to get everything out, see everything visibly, and then see how to sort it out. We do this in the house. There are times I know my colleagues, the females in the house are going to say, when you sort your handbag, there's things you'll find there that you never needed. There's things that are essential there. So similarly, we are trying to sort whatever is in our workspace. Setting is all about organizing what has been retained after sorting. The rule here is can see, can take, and can replace. This is for set. Shine is the third S. It entails keeping the work environment free of dirt, rubbish, dust, and in some cases, microorganisms. Standardizing is basically the measures you put in place to make sure that the other three S's are happening and they're working in the right way. Sustain, finally, is the one that holds everything together. It requires team discipline to ensure that the entire 5S cycle continues. 6S is safety in all aspects of healthcare. So we will go into sort now. Sorting is, as we said, the first things you do is you remove everything from all the storage spaces so that everything is visible. After you do that, you're going to categorize the items as necessary, occasionally necessary, and unnecessary. So items that are necessary are going to move to the step 2, which is the step of setting items. The items that are occasionally necessary will be stored in a space designated to them. And those ones that are not necessary can be either discarded or sent to other departments. Now, I will try to repeat this or emphasize this. In sorting, there will be items that you'll find are necessary. There's those which are necessary, but not always. And then you find the unnecessary items. But if you look at my gentleman here, he's a bit confused on which items he's going to keep and which ones he's going to discard. So there's a tool in 5S that helps us to decide whether an item is going to be necessary or not for us. And that one is known as the red tag. We are going to go to it in just a few slides. And that one is going to help you decide whether something can be necessary or unnecessary. Next is a picture of a ward. And this is them now in the process. They have just begun the process of sorting. As you can see, it's a jungle. They've got bed rails, blankets, bed linen, there's carpets, there's furniture. So it will take a while to sort all this, to decide what they need, what they do not need, and what needs to be stored in the necessary but not often used area. This is the tool that we were referring to, the one that we use for sorting. It's a red tag. First of all, just a disclaimer, a red tag does not always need to be red in color. Yes. So what this will do is it's going to help you make a decision. So ideally, you take a piece of paper, that is your red tag. You will write the date that you have decided this item. I'm not so sure whether this item I need it here or I do not need it here. So you put the item, you put the date down, describe the item, and then just have it there. Keep it for about a month. Within that month, if you see that that item has been used, then you are going to class it under necessary. However, if that item, a whole month passes and that item has not been utilized, then you're going to put it under not necessary. Once an item goes to not necessary, it can either be discarded or it can be taken for maintenance and then taken to other departments. You could have an item that to you is unnecessary, but it could be gold to another department. So that is something that we also need to keep in mind. What might not be necessary to us, we can relay the information to other departments where it can be of use. Again, I repeat, the red tag does not always have to be red in color. Any piece of paper will work. Remember, it's all about sustainability. So other tools, we mentioned that there's other tools that we also use in 5S. The reason I brought this slide here is because you will hear them as we go forward with the other steps. We will explain them further, but it's good that you know once you hear zoning or notice boards, that these are tools we use within 5S, within the 5 steps of 5S. So red tag is one tool that we use in sorting. Other tools we use, especially during set, is zoning and placement marks, notice boards, labeling, numbering, color coding, shadow boards. There is signages for things such as emergency exits, fire extinguishers, washrooms, and very importantly, we need to have signages for disability-friendly services within the facility. Another 5S tool that we have is alignment. So now that we know the other tools, let's jump into set. We've already done sorting. We have decided what is necessary and what is unnecessary. Now we come to set. So setting is where you organize all the items you found necessary in step 1. Every item should have a defined location. The items should be placed in a manner where you can see it, you can get it out, and you can replace it. And the rule is usually a 5-second rule. If you have placed it in a way that you can get it, retrieve it, and return it in 5 seconds, you are good to go, because that is the essence of 5S. Some important things you need to know is that the point of storage should be near the point of use. You cannot have an emergency crash cart that is lying in maybe the pediatric ward or maybe in the FP room, yet you need it in the OPD. So the point of storage should be near the point of use. Storage should be in the sequence of operation. For example, a good example that we like to give here, and even in terms of you store things in a way that the healthcare worker does not experiences the minimum amount of strain. So we say it is an ergonomic way of placing things. So returning things should be easy without even looking. So imagine for a healthcare worker, for example, the vaccinators. Every day you're vaccinating hundreds of either it's babies or adults. So every time you have to bend to the floor to put your injections into the safety box. By the end of it, sooner or later, you will have back issues. Your back is aching. So that is why we always recommend have something in an ergonomic position. If it's a nurse or a healthcare worker who is right-handed, make sure that the safety box is within a reach on that right-hand side for that healthcare worker. This will also avoid unnecessary needle stick injuries. I hope with setting that has somehow made sense. If you can see this image, there has been labeling that has been done. These are registers, and you know we have thousands of registers. These are blank registers. So they are placed in such a way, there's a label right here. If somebody wants a register, just read the name, pick it out. You can return it back in a matter of seconds. This is an example of sorting and setting. So this is before sorting. This is